Hello, my name is Harold. I'm a doctor. When I was 5, I had no idea what I wanted to be when I was growing up. When I was 10, I thought I'd like to be a famous footballer, but I soon realised that I wasn't good enough, so that never happened. I gradually became interested in becoming a doctor, as I had a very nice GP, and I admired the way in which he and other doctors were able to help people get better. So when I was 15, at school, I decided I was going to be a doctor. To become a doctor, I had to choose subjects such as maths, physics, chemistry and biology. So I worked hard, and when I finished my exams, I was allowed to start at medical school, at university. Whilst at university, again, I had to work very hard, but there was lots of fun to be had as well, and I played lots of sports. When I qualified as a doctor, I decided I wanted to be a surgeon. And I started my training as a surgeon for 3 years before I decided that that was not really for me after all. I then trained to become a GP, and I've now been a GP for over 20 years. I love being a GP. I love talking to my patients and love being able to help them. I learn new ways to treat them every day, and I hope that maybe one day you will be inspired to become a GP. No, that's it.
Hello, my name's Esther and I am a doctor. When I was 5, I wanted to be a pirate, but I realised actually that probably wasn't a very good career choice. So I then didn't know what I wanted to be. So I just carried on, did some exams, and I got some good results. So I spoke to my sister, who was already at university, and she suggested, why don't I think about being a doctor? And I looked into it and I thought, that's really cool, yeah. So you get to learn about the body and all the things your body can do, and how it's, when it was working well, that's really great, but when it's not working quite so well, what we can do to help you get better and to fix the body. So that's what I decided to do. So I worked really hard, lots of years at university and working as a junior doctor, and then now I've qualified as a GP and I work at the GP in the local surgery.
Hi, my name's Belinda. I'm a nurse practitioner. When I was 5 years old, I didn't know what I wanted to do, but as I got older, I decided I wanted to go into catering and hospitality, and my friends were doing health and social care. My younger sister was admitted to hospital with glue ear and very nasty ear infection, and the nurses there were fantastic. That inspired me to go into nursing. So I went to college, I got a job in a residential home, and from there I did my nurse training. I love being a nurse and I love working in general practice.
Hello, I'm Dr Jeter and I work as a GP here in Stoke-on-Trent. I'm going to tell you a little bit why I became a general practitioner. I really was very interested in studying science and physiology and how things worked, particularly biology and cells, and for that reason I took a degree in medicine on the advice of our head teacher, and now I find on a day-to-day basis when looking after patients I use this biology and science for their betterment, and I hope that you too can find a passion in a subject that will shape your career in the future.
Hi everybody, I'm Kelly and I am the children's nurse that works in the doctors. So my job is keeping all the children safe and well. And that can mean lots of different things. It can mean that I show you your teeth and help you look after your teeth. But it also means sometimes I have to give you some medicine. And it's funny kind of medicine. Sometimes we give it to you in your mouth, like mummy and daddy. But sometimes, like little Teddy Henry here, we have to pop it in your arms, which is a little bit weird. But we always put plasters on and you get really good stickers when you come and see me. Sometimes when you're not feeling very well, we have to do a bit of a funny thing where we put a little bit of a football light on your finger and you have to try and keep really still. And when this happens, on our little TV screen, we get a really good reason of what your heart's doing and what your breathing's doing. It's really clever. I try and make your time coming to see us as fun as possible, and sometimes when you're not feeling very well it can be a bit worrying, and mums and dads can be a bit worried too, but we're always here to help and give you lots of fun while you're here.
Hi everyone, I hope you're enjoying the talk so far. It does feel weird being on the screen when I'm right in front of you, but just wanted to go through some of the equipment that I couldn't bring in to the school to show you. Equipment that we use in general practice to help us help people by figuring out what's wrong with them, and it depends on the complaint that they come in with. So for example, if someone comes in with a cough, we have to examine their chest. If someone comes in with pain in their chest, we have to examine their heart. If someone comes in with an earache, then we have to look inside the ear. So all these things are really important for us to know how to use. And so when you're learning to become a doctor, you have to learn how to use this equipment and how to make a decision. Okay. And excuse my video skills, right? But this is the stethoscope, and I have brought this in with me today, so you can have a look at that and we can practice with this. The other thing that I wanted to show you was this. I mean, this is the body of a otoscope or an ophthalmoscope. So this is the head that goes on sometimes, and we can use this to check your ear, okay? And then this bit goes on sometimes. Sometimes this goes on and we can check inside your eye. So they both shine a nice bright light to help us look inside your eyes and your ears. Then this is the famous thermometer. You probably all know what this is. It checks your temperature and it helps us make a decision about antibiotics and things. Now this is what you call a blood pressure monitor. You probably haven't had a blood pressure done yet because you're too small, but when you're older you will, and it basically gives us an indication of how good your heart is pumping. Okay, and then this is the scary one. Some people don't like this. You have to use this to put inside your mouth so you can pull your tongue down so we can have a look at the back of your throat. A lot of people don't like it, especially little people, but just remember, we're only trying to use it to look at the back of your throat, not to hurt you.